Welcome back to HERcast with Dr. Chito. Our last episode, we had an in-depth conversation, episode titled Menopause, the Elephant in the Room, with Dr. Zara Mairami-Maiyaki, a leading obstetrician gynecologist here in Abuja, FCT. So today the conversation continues because we couldn't stop there. We hadn't covered all that we wanted to, and we know this is such an important conversation that we needed to get to the end of our discussion. So please stay tuned, relax, grab something, and just pay attention to the final conclusion of the episode, Menopause, the Elephant in the Room. Welcome, Dr. Army, again. I know we had a little break, but we're going to continue with this very in-depth conversation.
A very interesting one.
I know, before the break, we talked about what menopause was, the age, how it affects both our emotions, mental health, the dryness, the libido, how it affects hot flashes, the symptoms.
Yeah.
And I think I just want to expatiate more on certain areas. One area we spoke about very briefly was perimenopause. I think we should kind of like let them know what that feels like and when that actually the average age in which it starts and what changes they could be seeing to know that I am in perimenopause.
Okay, so perimenopause actually starts probably at the beginning of when the menopause should start, about the age of 45. That's when it starts. Of course, some people get it earlier. So maybe just a sentence on that. People who experience menopause before the age of 35, we call it premature menopause. And that could just be sometimes, in a few cases, it's natural. But otherwise, it's people who have had surgery to take out the ovaries for whatever reason. People who have had some radiation therapy, maybe for some malignancies or something to the pelvic area, and then it fries the ovaries, and therefore they're not able to produce the estrogen hormones as much as they should. So, or some people who have some severe mental illnesses, like depression, severe depression or something, and then it makes them lose so much weight, and then you find that the estrogen levels really dip, and then you become menopausal much earlier. So perimenopause, it's the beginning of the decline of the estrogen hormones. And before the periods begin to stop or begin to jump or, kind of misbehave, if I may use that word, you find other symptoms are affecting you. You just become a little more irritable. Your mood changes and you become more worried. You have insomnia. You're not able to sleep very well. You have the brain fog, just something in the brain. Your head feels just so full and you can't understand what's going on in there. And then before you know it, the periods start to misbehave. Sometimes you have more frequent cycles, but usually they become far and apart. So instead of bleeding every month, you find that you're bleeding every 2 months, every 3 months, 6 months. It just the gap keeps increasing until you go 1 year without a period, and that's when we say you have attained menopause. So that area, that period before the hormones really decline very well is called perimenopause. And it comes with all the symptoms that I have, enumerated here. And vaginal dryness, loss of libido, you're not interested in anything, you just want to be by yourself, you want to, you're not inspired to do anything. You have wedding and you have to drag yourself to go there and so on. You have some urinary symptoms, you begin to have aches and pains. Sometimes you have, people say they have some particular body odor and so on and so forth, because the estrogen really just used to help and so on. Now with its decline, your natural body, odor, kind of, if I may say, comes on, and it's not balanced by the estrogen that you had before. So you begin to perceive some unpleasant smell around you, and you're wondering what's happening to you, and so on and so forth. So these are all the symptoms of perimenopause before you get to menopause, and then it stops. Yeah,
so because I think that's something that I remember. Well, one thing that's very common with OB when people are worried about menopause, let me not lie, is fertility.
Yeah, sure.
As I will say, as the generation progresses, women are doing more, and some are really finding put it like trying to get pregnant later in life than before. And so your discussion on this is always very paramount, because the tests that we can do to kind of see where you are at in regards to your hormones and stuff like that, especially for those wanting to get pregnant. So I was just wondering, in terms of for your experience, because I think that's the saddest part for me when I see someone in their 40s, they want to get pregnant, they come, you do the test for their fertility to see how fertile they are or how they will respond, and you see this number and you have to explain this number to them.
Breaking the news is usually very difficult.
You may be at the end of, nearing the end of reproductive health. How do you relate that with your patients? I know you're very in tune. So how do you have that discussion with your patients when it comes to perimenopause and fertility?
Yeah. So traditionally the best period for you to have a child is between the ages of 25 and 35. But of course, nowadays, with people going after their careers, I mean, everyone has a right. You define your priorities and then you go. But I always say, make sure you have a good think about it. Because if this natural cycle goes past you, then there's no going back. Make sure it's something that you're not going to regret later in life. So have a balance, have a deep conversation with yourself, by yourself, and make sure it's something that you want to defer. If you're certain that you do not want to, pause your career to have a family, then it's fine. But make sure that's the path that you want to thread. And then there are, of course, other options. You get to the age of 35, that's not the end of your reproductive career. With technology now and science, you can boost you until the age of maybe about 45, kind of. It's a bit trickier, but it does happen, you know. And then, of course, if you want to go far, you can even do egg freezing, and so on and so. So you can delay.
I think that's what people are trying to do
Exactly,
now.
people are trying to do it now. So you can delay it, kind of, and say when you're ready, you've gotten to the end of your career, you're satisfied with that, and so on. Now you want to come back and start your family, then you can get your eggs, which you have frozen while they were at their peak, and then you can use them, and so on and so forth. But naturally, it's best between the ages of 25 and 35. So having said that, of course, there are people that probably have not had the opportunity to be in a relationship where they feel, yes, they have to be a married couple before they can have their start a family. Some people are unfortunate enough to get into that relationship until much later. So when you do that, it's just try, give it your all, go meet the fertility experts. They could try to boost your natural, the hormones inside of you, because as you said, you look at the hormones, sometimes you do the blood test and the figures are looking at you, and then you know that it's almost the end, and it's difficult, to break the news, to say to her, look, you've come to the end of it. So meet the fertility experts. They could probably boost, your hormone levels a little bit, and then you could have a child naturally. Of course, if you can't, there are other options, like egg donation and so on and so forth, depending on your belief and depending on how far you want to go. But at the end of the day, I say to people, even if you cannot have a child, you can impact on somebody's life very positively. There's so many children out there that you can adopt and give them a meaningful life, and you can be so fulfilled. It may not be the same as having your own, but it all depends on you. It's the outlook that you give it. It's the way you take it in, and just say, it's just me. Don't care about what the outside world say. Don't let the outside world determine your happiness or whatever. So just give it, be yourself and go about it. In Africa, we have large families. You have siblings and so on. You have relations in the village who cannot, they have lots of children, they cannot take care of them. You can get one and come and give him a good life within the four walls of your home. So there are many options. I say to people, it's not the end of the road. And everybody was not born the same. The fingers of the hand are not equal. Some will get married at the age of even 18 or even much earlier. You can have many children. Some get married at the age of 18 and they never have a child. Some get married at the age of 48 and luckily they can have their own biological child with their own eggs and so on. So it just depends on what is in store for you. Just be positive about it and work, the path. That's it.
I will really say something about large family. I think also one of the reasons why I think things are bearable too, in terms of people don't talk about menopause, because one of the most important things when it comes to mood is social connections.
Mm-hmm.
And I think one thing that we don't lack is when it comes to large families, social connection. There's always something happening.
Sure.
There's weekends of activities. There's always something happening. Even those that go to the villages or whatever, there's always something that's going on. Of course, that doesn't me. I know, like how you say, some people could have the mask, but inside they're breaking into pieces.
Yes, yeah.
And that's why we also talk about trying to break the stigma of mental health as well. Now, when it comes to that, I'm going to go into the culture, the reason, because the title is The Elephant in the Room. And many times we don't hear people talk about it. When you're talking about people coming to talk on stage for one reason or OB, you hear about fibroids, infertility, all these other things, but you hardly really hear about menopause. If you come for patients, they will come with complaints. Oh, I have vaginal dryness. And when you start talking about menopause, they're just like, oh, I'm fine. They kind of shut you down on the whole let's talk about menopause discussion. You have to kind of, go around it. Why do you think that's happening to us, and how can we break that? How can we start really, having more conversations on menopause on a wider platform?
So I think the stigma around menopause comes with the fact that people think it's something personal. And as I said in the beginning, people term it as men stop, not men who pause. So you're not pausing, you're not stopping the relationship with men. People think by the time you get to menopause, that's it. If you're in a relationship with your partner, will probably say, okay, now she is no longer a woman. And you want to look elsewhere. So she's fighting it. I'm still a woman. I'm still that woman to my husband. I shouldn't let him know so that he doesn't abandon me and start looking elsewhere, get somebody who is younger, or start having relationships outside, and so on and so forth. Even to your family members, you begin to think, okay, will they now see me of less of a woman? And that kind of thing. So I think that's the stigma around it. The fact that you think you've come to the end of a stage in life. People find it difficult to say, we want to live forever.
Yes.
We want to go on forever. You want to be in your prime forever.
Yes.
So accepting that you've come to that end, or that pause, as I always say, it's not the end for me, it's just a pause. And you just, find another direction and you continue living life to your fullest. Because of that pause, people believe that, is that the end for me? Is that it? What else can I do? There's nothing else for me. And then they don't want to talk about it. But I always say to people, look at it differently. You even have the opportunity to live this long. How many people, what's life expectancy in Nigeria? How many of us used to live to the age of 50? So now that you've gotten to 50 and you're experiencing this, it should be a plus, not a minus for you. And then if you are one of those who had children early, and your daughter, you probably have a daughter, and then she probably started her own reproductive career early. That's the time for you to now start having grandchildren.
Yes.
And then the joys that come with not just motherhood, but great grandmotherhood, come with it. So you're now able to go stay with your daughter, for her to have her own children. You help her go through what you went through, things that our parents never spoke about for our generation. I mean, you know what I'm talking about. There were certain things that were just never discussed, and you just experienced them along the way, and you just started wondering, why, and so on and so forth. So now you're better able to give your own daughter a much better support than you had.
Definitely.
I remember when I had my son, and people were congratulating me, and I said to them, you guys never told me about, you always spoke about the joys of motherhood. You never told me about the sleepless nights. I mean, everything comes with a price.
Yes.
So those sleepless nights for me were horrendous. I just could not, tolerate them. Because every hour my son would wake up and he would want to feed and so on. I never had straight hours of sleep. And I kept wondering, this is going to be for how long? Is this the end of my, my time for me, for life or whatever, And I said to my friends, tell us the good sides and also the not so good ones, so that people are better able to juggle it and so on and so forth. So please just take the opportunity, make the best of whatever situation you find yourself in. Yes, you're getting there, and I never let people ask me how old I am. I just say to them, I am so years young, so I'm not old and I'll never be old. That's what I say to people.
Amen to that.
Yes.
That's me for
Even
you.
If I'm in my 50s, they ask me how old are you, I'll say for I beg your pardon, I am so and so years
You're
young.
young,
Yeah,
yes. That's
not
what I'm going
old.
to be. I'm not old.
That word old is not in my vocabulary. Yeah.
And I think that's important to talk about. Now, let's talk about, be more specific about lifestyle changes. Why I'm saying that is we are in a climb that we like tablets. I mean, and when I say supplements, I always tell people that supplements are what they are, supplements.
Yeah.
Meaning that you get everything you can get from what you eat, and most times you don't need supplements.
Yes.
But I feel like as people grow, you're younger in reverse, older, that they have the bags get heavier and heavier.
Sure.
Some people talk about Primrose. I'm not saying that there are no supplements that could help you a bit in menopause, but people talk about take Primrose oil, take your multivitamins, take vitamin A, vitamin E,
omega,
take omega, so you are filled with all these supplements,
cod
which
liver
in my
oil.
mind sometimes when I want to do surgery, whatever, it gets complicated when I'm thinking, okay, all these drugs. And there's actually the other one, I was trying to remember it in one of the episodes I had, the Kohosh, the one that when you do surgery can cause bleeding.
Yes, exactly.
And I'm thinking, okay, all this, what advice do you have for that? Because what you say about lifestyle medication, the modifications, and this dependence on other supplements, the new ones that come out. Everybody talks about one thing or the other. You try. I mean, what do you have to say to?
Well, my opening statement in that would be the pharma industry would not pardon me, because if you go by me, honestly, your business would kind of decline. I always say to people, there are certain medications that are a must, like blood pressure medications, diabetes medications, things for cholesterol, and so on and so forth. For specific medical conditions, you need medications. We're going to talk about supplements. If you ask what is contained or what are contained in those supplements, they're natural ingredients. And you can always get them naturally without having them to be, modified and then made into a tablet and so on and so forth, making more expensive, etc., etc.
It costs a lot of money, yes.
It does cost a lot of money. Now, with the economic downturn, we know that we struggle with everything in life. You're struggling with children's education. We're struggling with food to buy and eat. In this country, we're struggling with power and so on and so forth. Everything costs a lot more. And our currency is not as strong as it used to be. So our earning capacity is not any better, and therefore we're struggling to make ends meet in terms of monetary requirements, financial obligations that we have. So why would you spend the little that you have on things that you do not necessarily have to spend money on? What you can do is you get your fruits and vegetables, all the fruits that we have lots and lots of fruits and vegetables in Nigeria. We grow a lot, When you go, we have one of the richest variety of vegetables in Nigeria. Get them fresh and eat them. They cost nothing. Many people grow them in at the back of their houses. So just take them and keep eating them all the time. Fruits, those are the things that people use to make, the pharma industries use to make the supplement. So why don't you just get them, little by little, eat many portions a day, make your smoothies and so on, and then take them. Lifestyle changes. Exercises. I know, okay, you can take milk, you can take fish, you can take your proteins, the fruits and vegetables in abundance. They can never be too much. So just keep taking them, and they would supplement for what you normally would have gotten from the tablets, from the supplements. And then, of course, as we said, you take some of those food supplements, those food classes like milk, and you put on some weight, especially around the belly area and so on and so forth. But exercise, whether or not you're taking these supplements, you need to exercise anyway. So make sure that you have your regular exercises, at least an hour walk 3 times a week. And make it a brisk walk. Just a walk is fine enough for you.
10,000 steps a day.
Exactly, 10,000 steps.
That's why I love my watch. I'm always clicking. Where am I now?
Exactly. Even if you don't have your watch, you have your phone. Exactly, and the phone has absolutely. So just take your 10,000 steps a day, and then sometimes make it brisk walks. In the evenings when you come back from work, from about 5 when the sun is down, just take a brisk walk, come back, sweat it out, and then have a shower, and then you settle down for the evening, have an early dinner, and so on and so forth. Make sure you know the times to eat. Don't eat very late at night. Make sure you know what to take and what not to take. Cut down on your sugars. cut down on the soft drinks, the fizzy drinks, and so on and so forth. I know some of us are guilty of that, but just try your best, and then most importantly, do your health checks so that you know that your numbers
so wellness
are still
visits
right.
is not an option. It's a
No,
must.
it's not an option.
It is going for an annual. I always say, doing your wellness check is not an option. It's not a I'm thinking about it. It's a must. I remember having a friend who I was talking about. Look, you're already almost 50. You've not done a mammogram. What's going on? And she was like, you that wants to go and find it, go and find it.
Exactly. That they'd rather not know.
You that want to look, go and find it. And I said, that's the worst attitude to have, because not looking for it doesn't stop it. But when you do the mammogram or whatever checks you need to do, then we can catch it early. And that saves your life.
Exactly. And it's treatable when you catch it early.
The same thing, you're very big on pap smears, cervical cancer, pathology.
Absolutely.
That's another area, that
we must encourage women.
That you must screen. You must do these tests. And I know that affordability has always been an issue. And hopefully, more foundations, more people will continue to support people in that cause, and hopefully we'll be able to subsidize those care, because I always tell women, when we talk about it, it's like, will you pay for me? And I'm like, I won't pay for you, but also let's make your health a priority, because everybody has a phone.
Sure.
And people spend a lot of money on
people
data.
People go for weddings. People go
buy
for
Ashobi.
Exactly.
They'll find a way to get that Ashobi.
Yeah. But so always when it comes to your health,
so make your health as
it's secondary. It's not a priority for them.
Make it priority. Make it. This is the first thing I have to face. You're going through menopause. A lot of things actually become a little different, and if you don't take care of yourself, you could end up transitioning not the right way.
Sure.
Yes, that's one thing I want to talk about. Now, I know most times we're very iffy about talking about medications, because we don't want people running to the pharmacy and buying the drugs for themselves, which could be very harmful. But I know that we can talk about, there's this alternative treatment for hot flashes that people talk about. I'm going to make it just called the general term, antidepressants.
Yeah.
So people have started using antidepressants for managing the hot flashes, a specific type of antidepressant. Is this something that's common in Nigeria as well, where people use antidepressants to manage hot flashes? And I know there's a stigma.
Sure.
But what time you say it's antidepressant, even if you say it's for hot flashes, their eyes will open.
Absolutely.
And the ears, meaning that, are you saying something you're not?
There's
something you're not telling me.
You're not telling me.
But
are you going through some? Are you going off?
Yes.
That kind of thing.
What has been your experience with people when you talk about
yes,
treatment?
as you said, people have tried all sorts. For some it works, for some it doesn't work. So I always say there's no one cap fits all. You try different things. If it works, fine, you continue. If it doesn't, then you change to something else. So antidepressants have worked. Sometimes just having a conversation helps a lot, and that's what I usually do for the majority of my patients. If it doesn't, then go through the antidepressants. If not, maybe just say, okay, some other medications like you can use the lubricants for the vaginal dryness and so on and so forth, mood enhancers, etc., etc. Sometimes people are not able to sleep, so just give them some natural remedies that would help them sleep, etc., etc. But then the final bus stop is the hormone replacement therapy. Now, the hormones are medications. They are drugs, and they are not over-the-counter drugs.
No.
So just as every medication, they have their side effects. So they have their good sides, and then they have not so good sides. Therefore, before you take hormone replacement, you must be seen by your gynecologist. And the gynecologist would assess you from head to toe, make sure you don't have any risk factors that could be exacerbated by the hormones. You don't have a propensity for some malignancies and so on and so forth. And then if you're okay, they will prescribe the hormone replacement for you. If they do prescribe hormone replacement for you, it's not something that you take today and just go to sleep. You have to keep coming back for regular checks. Because if we give the hormone replacements, we also have to bear in mind that they could increase, the depth of the lining of the womb, and then that might also be another, complication and so on. So we have to give another drug to counter it, so that you can kind of bleed, after some time, and then it sheds it, so it's not building up too much, and so on and so forth. So if you start hormone replacement, you must continue seeing a gynecologist, and they keep checking on you all the time to make sure that you're still okay, and you're not developing any untoward signs and
Study.
symptoms, yeah, and complications.
All right. I think we've kind of touched in each topic. I'm just gonna summarize. But is there anything you want to add before I summarize menopause? Is there anything that because menopause could be, we can talk about menopause for a long time. Unfortunately, time is against us. But is there any other thing you want to add that you want, let's say, tell that women out there about menopause?
All I'll say about menopause is let's not keep it to ourselves. Let's talk about it. Let's bring it out in the open. There's no stigma around it. There shouldn't be. It's a natural process. It's a normal thing. People go through it. It's the price that we pay for getting to that age. So there's nothing negative about it. Let's talk about it so that people would benefit. We ourselves will benefit, discuss it. People are better able to deal with it. And, we know everything about it. That's all I will say. Let's bring it on.
Let's keep the conversation going.
Yeah.
All right. Thank you so much, Dr. Mairami-Maiyaki. Thank you so much. Just to summarize, what we talked about is, one, what is menopause? Menopause is the end of your reproductive cycle. It's a transition process. And also it's the decline of the hormone estrogen in your body. Like she said, it's symptoms that it causes are hot flashes. You can get vaginal dryness. You can have problems with your sleep. You can have emotional health issues like irritability. You can also have mental health issues like depression. We talk about weakening of the bones because how estrogen protects the bone. Also an increased risk for heart problems. So that's the problem, the symptoms. We also talked about, the management of it. We can't really talk about specific drugs, but we talked about hormonal replacement therapy as being one of the best treatment. I didn't even say that. Hot flashes, like number one up there, of hot flashes and other symptoms. And what we said about hormone replacement therapy is that, of course, you have to see a gynecologist to prescribe that if that's what you need. One of the things we talk about there is most times you try the smallest amount for the shortest period for many reasons. And that's why it's important that you see a gynecologist for taking anything that's not over the counter. Of course, there are vaginal moisturizers for people that have very bad vaginal dryness. And also there's also what I believe is be open to seek counseling when you do have like a high level of irritability or you feel depressed. And it's very important so that you can at least improve the quality of your life. Sleep, we talked about that as well. You may have challenges, and if you can't cope, then you need to see the doctor who will guide you through different sleep practices that will improve your symptoms. We also spoke about the stigma and how the conversation should never stop, how we should continue talking about this. It should not be the elephant in the room. It should be an open conversation where we're talking about a natural process that we go through. So I think I've summarized it a bit in one as much as I can. So thank you for joining us on this enlightening journey through menopause, the elephant in the room. We hope that Dr. Zara Mairami-Mayaki's expert insights have provided you with a deeper understanding of menopause and empowered you the knowledge to manage this transition effectively. Remember, menopause is a natural part of life, and with the right information and support, you can navigate it with confidence and grace. If you missed any part of our discussion, you can catch the full episodes on our YouTube channel, HERcast with Dr. Chito. For the latest updates, or you have any questions after this, you can also follow us on Instagram at HERcast Podcast and at Dr. Chito N. And don't forget to tune into Rapid TV channel 176 Startimes every Saturday at 7 p.m. and Sunday at 2 p.m. Thank you for being a part of this important conversation. Stay informed, stay healthy, and we'll see you next time on HERcast with Dr. Chito.